Welcome to an overview of Family Life Education. We're so happy that you could join us today. There's an information sheet to accompany this video. It might be helpful for you to follow along as you watch. My name is Bridget Walsh. I'm an associate professor at the University of Nevada, Reno. I've been a certified family life educator, or CFLE, for approximately 8 years. I teach family life education at our university, and in 2016, the National Council on Family Relations recognized me as the CFLE of the Year. This video is going to underscore many of the main hallmarks of family life education. There are 4 objectives for today's module. The first objective is to identify and to describe key concepts of family life education. The second objective is to identify and describe similarities and differences between family life education, family therapy, and family case management. The third objective is to be able to recognize the 10 CFLE content areas, including parent education and guidance. And the fourth objective is to understand a little bit more about the role of a Certified Family Life Educator, or CFLE. The first objective is that home visitors will be able to identify and to describe key concepts of family life education. These include terms like empowerment, multidisciplinary, and strengths-based education. Let's hear from some current FLEs and some up-and-coming FLEs about these terms.
Evidence-based and evidence-informed are essential parts of the framework for best practices in family life education. Programs that are evidence-based have already been researched or evaluated appropriately in order to show that the program will have an overall positive effect. Evidence-informed programs are based on existing research and theory, but have yet to be empirically tested. There are many advantages to having evidence-based programs. For one, programs that are evidence-based and evidence-informed are more likely to promote strong and healthy families. Also, since the research has already been done, data would show that the benefits of the program would outweigh the overall cost.
So using strengths-based approach really allows you to work on your strengths and things that you're already strong in. Because if you really work and you focus on your strengths, the weaknesses that you have will mitigate and they'll become easier to work on. So having a strengths-based approach is really awesome because it allows you to set goals based on your strengths. And while you're working on those strengths, unknowingly, you'll be able to work on your weaknesses as well.
Attachment is a strong, affectionate tie that binds individuals together through space and time. It begins before birth, and patterns formed in infancy can continue to influence personality and behavior throughout the lifespan. Securely attached infants feel confident and comfortable to explore their world, and this can lead to good relationships and positive self-esteem in adulthood.
Multidisciplinary makes the family field unique, given that many fields hold the pieces to the individual family development puzzle. We can't understand or work with children in isolation from their families. Contexts matter, and it takes psychologists, social workers, case managers, family life educators, family therapists, sociologists, and many more to work with diverse families. While many disciplines have unique qualities, one commonality that we all share is the goal of healthy and strong families.
The doing for versus being with model is a strength-based approach we use in early Head Start home visiting. Doing for is popular practice, which detracts from the focus of unique child development, and the focus then simply becomes fixing problems. In the being with concept, the home visitor functions as a coach to support the parents while they experience everyday interactions with their children. This encourages sustainable self-confidence in their parenting skills.
Collaboration is the essence of our work as CFLEs. A great example of this is how we work with families in shared goal making. We know that we are most effective in these partnerships when we utilize the strength and knowledge of others. Though we always strive to be expert professionals with resources to provide, what is so important is that at the same time, we seek to find room to grow as collaborators and learn from the unique experiences of those we work with.
So within the scope of family life education, prevention programs help families to develop knowledge and skills to build or maintain strong relationships in the event that problems will arise, which we know they will arise. So effective programs strive to increase protective or resiliency factors while simultaneously decreasing risk factors that will increase family vulnerability. I like best how Merriam-Webster defines prevention as the act of keeping from happening or existing. And another sub-definition is to deprive of power. And I think that if we render risk factors powerless, we return power to the families, the safeguarding factors, and we help stop in the tracks the serious issues from occurring.
Okay, so in family life education, family empowerment means that families have the skills, knowledge, and education to make decisions that contribute to healthy family functioning. So as professionals, something important to remember is that it's not really our job to think that we're the keepers of the knowledge about family empowerment. Rather, it's our job to help families identify the strengths they already have so that empowerment comes from within their own family system. So families who feel empowered know how to nurture their strengths when times are good, as well as draw on those strengths in times of stress or adversity. And so then the goal of family life education is to work with families before crisis hits so they feel empowered to take action and draw on their strengths when they need to.
Relationship-based care is essential to family life education. This could include focusing on the parent and child relationship, as well as a relationship triad of parent, child, and family life educator. Relationship-based care may include A, continuity of care between families and the professional, and B, professionals genuinely finding out about families, including their strengths and challenges. When the professional sets goals with the families and values their voice, they are also honoring relationship-based care.
The next objective is to recognize similarities and differences between family life education, family therapy, and family case management. This comes from the work of Myers et al. 2011 and their Domains of Family Practice model, which was published in Family Relations. All three professions share the goal of strong, healthy families. We also value research-based practice, sensitivity to diversity, different ecological contexts, and a code of ethics. We also value a family systems theory. However, there are distinctions between these three areas. Family life educators value primary and secondary prevention. Home visiting is an example of secondary prevention. Family therapists often work at the level of secondary and tertiary prevention, repairing problems and providing therapeutic interventions. Family case managers often put off fires and serve as family advocates and want to know family needs, working at the tertiary level. The next objective is that home visitors will be able to recognize content areas within family life education. The National Council on Family Relations has 10 content areas. These include families and individuals in society, internal dynamics of families, human growth and development, human sexuality, interpersonal relationships, parent education and guidance, family resource management, family law and public policy, professional ethics and practice, and family life education methodology. Out of these 10 content areas, think about parent education and guidance and list some of the things that you do in your work that might be germane to that content area. The last objective is that home visitors will be able to identify and to describe roles of a Certified Family Life Educator, or CFLE. There are two paths to becoming a CFLE. One is to take coursework at an NCFR-approved university or institution. This coursework parallels the 10 content areas that were previously mentioned. The second route is to earn a pass score on the national exam. Once you become a provisional CFLE through the coursework or by passing an exam, then you are required to document hours to show that you have application and experience and understand the practice of CFLE. There were 3 references for today's presentation: Darling and Cassidy, Family Life Education, Working with Families Across the Lifespan; Myers-Walls et al., their 2011 article in Family Relations that highlights the domains of family practice; And then the National Council on Family Relations has a chapter in Bredehoff and Welkeski's Family Life Education, Integrating Theory and Practice. There's also a third edition of that textbook. These are great references to read more about family life education. We're almost close to completing the video portion of this module. It would be helpful for you to 1, review the information sheet, 2, take a brief survey, and then 3, we'd love to hear any questions you have, any insights, or any comments on the Padlet that accompanies this video. Going forward, we have something for you to think about. We'd like you to consider how your work as an early Head Start home visitor integrates with family life education. You could brainstorm, you could look back through this PowerPoint or this information, but really think about work that you do already and how it fits with the main hallmarks of family life education.